Hi, I'm Alyssa Spencer.
Hi, I'm Stacy Partain, and we're research assistants in the Lip, Tongue, and Larynx Lab at Michigan State University under the direction of Dr. Jeff Searle. Our study is focused on how communication is impacted in people treated for head and neck cancer. We are particularly interested in how patient perceptions of communication have changed over time since completing cancer treatment. This is an ongoing study that will discuss the methodology used and present the preliminary results obtained.
The aims of the study are to first describe the patient's perspective regarding the impact on their communication from the following variables: cancer treatment methods, cancer stage, speech language therapy, or other factors identified by the participant. The second aim is to understand the patient's perception of how aging may be affecting their communication abilities, either separate from or in combination with the effects of their cancer treatment.
There is currently a gap in the literature regarding the communication abilities of head and neck cancer survivors changes over the course of several years after achieving a new baseline form of communication. Very little has been reported about the long-term communication outcomes in patients treated for oral and oropharyngeal cancer. Individuals treated for laryngeal cancer have been evaluated more often for long-term communication results, particularly those who have undergone a total laryngectomy. But even this patient population has received scant attention beyond outcomes 2 years post-surgery. It is also important to acknowledge that the group of individuals undergoing the total laryngectomy today is different from those who have been studied in the past. This study intends to bridge the gap in research in this area.
The criteria for participation in this study includes completion of cancer treatment a minimum of 5 years before enrollment. The cancer location, tumor stage, and type of cancer treatment are not used as exclusion criteria. We currently have 3 enrolled participants with a total laryngectomy completed at least 10 years prior to our study. The conduction of this study was altered due to COVID-19, and participant interviews were done via Zoom. One interview, around 60 minutes, was done for each participant. The interviews consisted of questions regarding the participants' cancer, treatments received, and their participations of their communication and how that has changed over time. After the interview, participants were asked to complete 4 scales and inventories to self-rate their communication participation, fatigue across several domains, effort with communication, and confidence in activities given their particular condition. In regard to the interviews, content analysis has been done for 1 interview and will be done with the remaining and future interviews as well. Upon completion of all interviews, an overall coding will be done using content analysis to find common themes among participants' interview responses. Summary statistics will be calculated for the scales as the study includes more participants. Participants completed 4 scales and inventories to compare the summary statistics of the scale results with the content analysis. The first scale given was the communicative participation item bank short form to rate the extent to which various aspects of communication participation are impacted by their status post-treatment for head and neck cancer. Our interviewee scored a 16 on the communicative participation item bank short form, indicating a moderate level of participation. Furthermore, the participants completed a multidimensional fatigue symptom inventory to estimate fatigue across several domains, and our interviewee scored moderately high levels of mental fatigue and physical fatigue versus mild general fatigue and reduced activity and motivation levels. The Borg rating of perceived exertion indicated the effort associated with communication, in which this participant scored a 12 and noted that communication exertion is light to somewhat hard. Lastly, the self-efficiency for managing chronic disease 6-item scale was given to rate the level of confidence they have in doing 6 activities given their particular condition. This interviewee scored a scale result of 7.6, which displayed a moderately high level of confidence that he can complete activities that he needs or wants to do.
As for the content analysis, we looked back at our transcription of the interview and recognized specific themes and created meaning units. From here, we created categories and subcategories that you can see in the first 2 columns of the content analysis table. These categories and subcategories consisted of participants' areas of focus, as well as issues and concerns that he expressed in the interview. The far right column of the content analysis table consists of specific quotes that fit into that particular category. Due to the lack of fully completed interviews, our content analysis is still in preliminary stages, and we plan to expand on this as we continue conducting and analyzing interviews. For our first participant, there were a few differences between his scale results and the content analysis of his interview. After interpreting his scores on the scales, we noted that although his scores indicated high physical and mental fatigue, he did not discuss this aspect in the interview. Furthermore, the communicative participation item bank form score suggests moderate restriction in communication, yet this participant also did not mention this difficulty in the interview. Several of the scale results, however, did align with the topics that were discussed in the interview. For example, his RPE rating and moderately high confidence in managing his condition were reflected in the interview. As our study progresses, participants' responses and scores will be analyzed by our team and eventually compared and scaled to find common themes to help bridge the current gap in research in this area. Thank you for taking the time to listen to our presentation. We hope you have a great day.